So, Rebecca, how was your week?
It's been a great week, thank you. Busy week with my two teenagers. I've had prom for my eldest. He's finished his GCSEs. My youngest has had a week of SATs. So busy week, and I had a really good day this morning because I knew I was coming on this, and I wanted to talk about my latest publication. And I didn't actually know where it had been published until I randomly Google searched it this morning to see that it had been published. I just weren't sure.
Congratulations!
Thank you.
Congratulations.
Yeah, it's just an article in The Dentist talking about some of the work that I do. I'm very passionate about my orthodontics and extremely grateful to IAS Academy, who have mentored me for every single case that I've done, which I think is the secret. And the article talks about the benefits of mentorship.
Cool.
Amazing.
So what was in the article?
So the article is about SureSmile aligners, which I use a range of aligners using Invisalign. I have used CFast, and mainly I use SureSmile because I like the adaptable trim lines. A lot of trim lines are scalloped, and you have to have a lot of attachments, just the mechanics of the aligners. The SureSmile, you can have straight trim lines and you can adjust the height of them. So this case had, I think, a 1mm trim line, no attachments at all, and it tracked perfectly, no refiners.
Cool.
So lovely and discreet because you may have clients or patients that want to be utterly discreet. We've had patients that have been in period dramas. They can't have attachments on their teeth, can't have brackets on their teeth, but they want their straight teeth, so they can take them out for certain areas or scenes where you can't even see they're in if they're totally invisible with no attachments.
Wow.
And this case was quite a straightforward case. It was mainly anterior alignment, but it tracked perfectly. Aligners are very good. Tilting teeth, tipping teeth, which it was quite a lot. Some minor rotations, but it worked perfectly. If you plan the case well and have the correct case, you can do it quite easily.
Well
It was
done.
great. So
Really
thank
cool.
you.
Oh,
That is-
congratulations.
thank
That's
you.
awesome.
That's a massive. So, Ali, how was your week?
I've had a good week, but a busy week. My week, yeah,
Standard.
it is becoming it. Yeah, it's my week actually started on Sunday. I was in Bournemouth, visiting a friend I lived with in uni. His name's Gareth, and him, myself, and Zach, because Gareth and Zach own Smile Stories in Bournemouth. Really cool practice, really different. You know, they're wearing jeans, call their patients clients.
Oh,
They've won a
great.
few awards for it, but they do incredible work. That's the big thing, that their workflows and the quality of their clinical work is phenomenal. So actually I was going there to mentor one of their associates, Harry, for a full arch case on Monday. So I went up a day early. The sun was out. The thing is, when I left Cardiff, it was raining. So I dressed for winter, and I got there and it was hot, and I was on the beach, and it was like Ibiza. I'm not kidding.
Nice.
And Gareth came with me to the hotel to check in. Beautiful hotel called the Nicky. And they thought we were a couple, so they upgraded me to a suite and said, "You two have a lovely stay." And he said, "I'm going back to my wife." And I said, "Gareth, keep quiet. I've got a lovely room." So stayed the night. Harry did really well. Zach's sister Sabrina sedated the patient for the case, and it was a really tough case, and it went beautifully. But it was a long drive back again then, which is fine. But the time's adding up, so that kind of brings me to another reason it was such a great week, because our friend Dr. Akash Maru started with us, and he's going to be the pressure valve on me to take over some of the implant cases here,
Oh,
because
great.
we're so busy. Yeah.
Fantastic.
And it's great because I worked with Ash in Hereford for years, and then I mentored him for about 6 months, where I was going up to Hereford, and he's just the nicest guy, really good surgeon, but his condition was he'll come work with us if we play paddle every Friday. So Rebecca was asking me before we started filming, what is paddle? And we learned this when we went to the Southern Implants Conference in South Africa. It's a mixture between squash and tennis. And we thought we'll play once, and I think the whole team's kind of getting into it. So Friday afternoons are paddle afternoons.
Oh, I might do. I used to play squash. My dad was a dentist before he retired, and I used to play squash with him. He used to play with his partner every Wednesday.
Cool.
So I've been playing squash for years. I haven't played it for a while, but yeah, I'd love to come and have a go. Great.
And Flo's really up for it because
Yeah.
well, I'm going to ask you about this in a minute.
No.
But yeah, and also what was really cool is that there was it's a bit delayed, but there was I might have spoken about this before, but I've been thinking about it a lot this week, that at Lilia's nursery, they had a Father's Day activity. And I was thinking about the fact that we're so busy and we're so lucky to have all these good things happening, you know, publishing, teaching, seeing patients, going on courses. But I'm so thankful for the flexibility to have been able to go, you know what, I'm clearing a couple of hours in my schedule to go and paint this keyring and have some ice cream with her.
Totally.
So yeah, all very good things. How was your week, Flo?
It was good. It was good. Yeah, I've been in Portugal, which was lovely. Just well, relaxing. I don't really relax very well, so just doing some
I can
work.
imagine. Yeah.
Yeah, working on some papers and things, and
Cool.
yeah, played some paddle.
For the first time?
So I'd done a little bit before, but yeah, properly first time. But it was only me and Tom, so we were on the singles court
Okay.
rather than any doubles. And it did just highlight exactly how I used to play squash, which is I'm very good at squash, but I run into walls a lot. So I was running into the walls on the side a lot.
So that's what's going to happen when we all get together and play then.
This sounds familiar. We might be. It'd be fun.
I love it. But yeah, so it's been a relaxing week. I then had a very stressful flight back, but I've made it here, and that's
Well done.
that's the main thing. So for those that don't know, we are doing a special series of episodes covering women in dentistry. We're highlighting some absolutely badass women who are pushing the boundaries in the dental field. This week, the voice that you've heard, we are joined by Dr. Rebecca Williams. She is a fellow Cardiff University graduate who studied both psychology and dentistry. She has a range of postgraduate training, including advanced SureSmile providers, as you said, a PG dip in orthodontics and cosmetic dentistry. She is a member of the IAS Academy and a real trailblazer in the Cardiff orthodontic scene. Recently being published, as you said, for that fascinating case looking at aesthetics and functional orthodontic options. And we're incredibly lucky to have you with us today.
Oh, thank you for inviting me.
How did you find Cardiff Uni?
Oh, it was fantastic. So I went back, it was my second degree. I did psychology. I met my husband doing my psychology degree. And then I got married in my first year of dental school. So he, bless him, funded me through dentistry. Knew that I really wanted it. My dad's a dentist, was retired now. Always wanted to do it, but I wasn't quite sure. So I decided psychology, loved it, and then thought, no, I'll go back and do dentistry.
Wow.
So yep, love Cardiff. Married a Welsh boy, so I've stayed here, settled, had a family.
Well,
It's a
where are you
lovely
from?
city. Somerset.
Okay.
Oh,
So,
lovely.
yeah.
Lovely part. So do you use the sort of the psychology degree, do you think, in dentistry? There must be some certain
Definitely.
bits.
Definitely fascinating looking at how people interact and the relationships we forge with our contemporaries, with our patients. A lot of the skill of dentistry is not just the skill or the art of the work, it's how you communicate. I think that's a huge part of it. So try to use as much as I can.
Do you feel like you had a grip of this when you came into dentistry because of your degree? Or do you feel like you still went through the learning curve that most dentists go through where you learn communication in dentistry?
I possibly had a little bit of an advantage from having another degree and being a couple of years older. I think that goes a long way. I think that's part of the reason that the dental degree is 5 years, because you become just a little bit more mature when you come out.
I completely agree. I think one of the things I find so crazy with dentistry is some people, their first ever job can be dentistry.
Yeah, and you're really young when you come out, you're a baby, so it's nice to have a couple of grey hairs and people trust you a little bit more, I think.
Did you have a job before?
I had some weird jobs. I told you about one of my jobs where I worked as a waiter when I was a student for some events, but on the same night I managed to it was a Christmas time, and they gave me a tray of champagne as welcome drinks for like office Christmas parties at a hotel in Cardiff. And I didn't want to keep going back and forth to put 2 or 3 glasses on the tray, so I put like 20 glasses on the tray and dropped them all.
Oh no.
And then I burnt the back of someone's head with a hot plate trying to serve them, going around them. And I thought, I'm gonna get sacked, but I was the only one. Still, there were people there who worked there for years, and I was still the only one who knew which side the fork and knife go on. So they offered me like a permanent job, and I thought, you definitely shouldn't be offering me a job. But yeah, I had some weird, I mean, that was one of the things I was terrible at. I had jobs, but not right, because I grew up in Kenya. We taught football camps and all sorts of things, but not serious jobs like you did, Flo.
Yeah, they weren't that serious, but
They
yeah.
were serious. No, go on. What kind of jobs did you do?
Gosh, well, I did the standard like kitchen cleaning and a lot of cleaning jobs, like cleaning uni halls, and I was a GP receptionist. I worked in Canada for a couple of years teaching like climbing on summer camps.
Serious jobs.
And we've done some
So
similar
you've done some
things.
similar things?
I did dental nursing for
Oh wow, okay.
about 8 months before I did my dental degree, because my dad's a dentist, and so I thought I wanted to work for someone different. I actually ended up being his VT. It's funny.
Oh,
And then
wow.
I worked for his sister. No, sorry, yeah. How did it work? I was his nurse. His sister, I was his VT, and then I worked then for their friend. Everyone knows everyone in Cardiff. That's how all my jobs have been, through people I've known.
Yeah.
Which is funny. But no, I did dental nursing. I did lots of waitressing. I worked abroad when I got together with my husband, and he was a pharmacist. He got offered a job in Bermuda. We hadn't been together very long, and he asked me to go with him.
Wow.
So I went with him, and because I'd done my psychology degree, I was doing lots of volunteering with some disabled children, which was amazing. I did some dolphin training for Dolphin Quest.
Oh wow.
Yeah, it was fabulous.
So make that-
So I had a lot of
that's
fun
very
before
cool.
I did my dental degree. So I came back and I was set that I knew that's what I wanted to do.
I want to change my answer. I haven't really done any real jobs. Yeah, you guys have done some really cool stuff, and I feel like it served you both well.
Shapes you, yeah.
yeah, amazing.
Definitely. So how did you then get into orthodontics?
Okay, so I always wanted to do ortho. When I was at Cardiff Uni, I used to spend because I was a mature student, you'd think you'd come in with a slightly different attitude. I was married, I'd done my psychology degree, so I lived with my girlfriends, who are still some of my best friends. I lived with them and had the whole student life, so it was a different mindset coming in for dentistry because I was studying, I was married, so it was different. So my Wednesday afternoons I used to spend with Professor Oliver, bonding up, changing brackets, wires under his supervision. I absolutely loved it. Always wanted to do ortho. But then we were married and I wanted a family, and I was a couple of years older, and I got pregnant in my VT year, which was amazing. Not ideal because it was right in the middle of my VT year, but Neil Soudan Taylor was absolutely amazing. Everyone
he
looked
after our
there we
group as
go.
well. He was amazing.
He was brilliant.
In fact, he actually set up my wife and I.
Oh, there you
So
go. Funny.
him and
he's a great guy.
Pat Satchel.
Yeah.
in
Pat's
Lakeside.
lovely. Yeah.
So Zara was Pat's VT.
Okay.
And Pat and Neil were saying, wouldn't they make a nice couple? And they were both whispering in our ears. And so I saw
I
Neil
love
at the old
that.
cottage, the pub down the road,
Yeah.
a few years ago, and I said thank you, and I gave him a hug because yeah. So yeah, I can see how like he must have been the most amazing person.
He was
you find out
brilliant.
you're pregnant, and he's the person you
He
want
was
helping.
brilliant. He looked after me. We worked out a plan that I could finish my VT year and have a newborn, which was quite tricky. I wanted to feed Owen myself, which I managed to do with supportive VT tutors. I was really lucky. It's difficult going back because I always wanted to be a mum, and it was really hard. Had massive mum guilt being back to work, but it meant then that I could finish my VT year, and then I had 6 months off afterwards. So I did it the other way around. We had Owen so he's my eldest. He went to nursery at the Royal Glamorgan Hospital, which was round the corner from my training practice. So I'd be up there lunchtime, so I'd be up there in the morning. They were brilliant. He was the youngest baby they'd ever had. I still feel guilty about it because he was so young and he should have been with me. But they were brilliant because they were like, he needs love and milk, and that's what he had. And he's an amazing young man. So although I sort of still have that mum guilt of going back, I didn't need to repeat the year, and then I had the 6 months off afterwards, and I've been part-time ever since. And I actually think with the nursery, he's such a smart boy. Both obviously I'm biased, but they are smart boys. I think the nursery kind of helped that as well. And I was lucky with my husband being really supportive. His days off, he had Owen straight away, so he's a brilliant dad.
Awesome.
Because we were very much a team, and he supported me because he knew this is what we wanted to do, and things happen for a reason. You can't always plan exactly, and he came along, and what a blessing he was. Hey,
Because you say it wasn't ideal timing, but is there ideal timing?
no, I don't think so. So I had Ollie 2 years later. I had more the traditional 6 months off. I think I had off, and then I'm only part-time anyway, so then I went back to work 2 days a week then and carried on. But no, you just have to have a baby. I wouldn't change anything because I've got my amazing boys. So.
And what do you do now? What's your work pattern like? Because you were saying I've been part-time since then.
Yeah, so I was I was always 2 days. I've worked for a few different people. My longest until now, my longest placement I worked. You may know Doug Goodwin. He was a
Yes.
yeah, Doug,
He
brilliant.
supervised me when I was in uni.
There we go.
Yeah.
Everyone knows everyone in Cardiff.
Yeah.
So I worked with Doug for 10 years. Doug is a legend.
Yeah.
Doug, I love you, Doug.
Yeah.
He's brilliant. He taught me everything I know. It was only a 2-surgery practice with a sliding door. He checked everything. He literally taught me so much. I'm still, so our old team with the nurses and the dentists that were there, we still meet up twice a year.
Oh, wow.
Doug's brilliant. He was very caring whenever I've gone for a new job. He's wants to know who I'm working for, what I'm doing. He really taught me so much. So I'm so grateful. So I worked 2 days for him. He then retired and sold up the practice. And then I decided to look elsewhere, maybe a little bit, because I used to work up in Blackwood, so a little bit of a trek. Decided to look closer to home. One of my friends, Katie from uni, has worked for Bob and Dave forever and had always been saying, "Oh, Beck, you'd love it." But I was happy where I was. I knew she was happy, but I loved where I was. It was very much in my comfort zone. I did work, you were saying, I did work a couple of days more just before COVID, just before he sold. And I would never do that again. I was working, I always worked 2 days. Someone left and I picked up a day, and then I was doing 3.5 days, so basically 4. And I was help out again on a Friday. Just before COVID, I had flu twice. It may have been COVID, knocked me for 6. I'm sure I was trying to do too much.
Yeah.
I was working hard, a young family at the time. My husband's got a pharmacy, his own business, so he's really busy. He coaches both my boys rugby. We're quite full on. Because I don't coach rugby and my boys are really sporty. I was the fixture secretary. I've just retired now from 8 years. So I organised the fixtures from under 7s all the way through to under 16. I love doing it because my husband coached both age groups. It's really beneficial for me doing it. So that meant that I could organise fixtures so that he could coach Ollie and then Owen straight after.
That's brilliant.
So that's why I did it. And I loved doing it. And I loved all the banter with the coaches and all the different teams across the city. It's volunteer work. It's, as long as you're organised, it was a nice thing to do. So I was quite full on. Then COVID happened. And then I luckily got the job with Bob and Dave. And I've worked less, and I think it's easier for me to manage everything. It was a complete gamble with Bob and Dave. They didn't have an opening. They created a space for me. I started off doing just a Monday morning, 8 till 2, which I still do. And there was no existing list, but because of COVID and people needing private dentists, it built up rapidly.
Perfect timing to start.
Perfect timing. I then picked up a Friday afternoon because there was a free surgery, so I jumped on, said, "Can I do the Friday afternoon?" Great. They were then planning a big extension, so Bob and Dave said, "What would you like to do? You can do kind of what you like within reason, as long as it works. You ask, we'll see what we do." So I said, "Right, ideally I'd like to do the Wednesday, Thursday." I've always worked a Wednesday, Thursday and keep the Monday. But again, there was no guarantee. There was no, Bob and Dave don't work clinically now. They're more or less the clinical directors of our company. But their lists had been passed over to other people already. So it was a gamble, and it's paid off. It's taken me, the extension's been up and running for 2 years in October it will be, and I'm full now. So, you know, you can see me within a few weeks, but it's taken a while to build up, but it's a lovely practice. And I'm been really lucky to have the support from them. When I started, there are lots of dentists that like yourselves, very qualified, have done lots of courses, and you come in here and you've got your certificates, and it's amazing. It's quite overwhelming. And I felt that when I started at Cox and Hitchcock's, and I thought, oh gosh, I've been in my lovely practice in Blackwood, loved it. Hopefully I've been a good dentist, but I haven't really branched much out of the general DP world. And so when I started Cox and Hitchcock's, I thought, oh gosh, what have I got to offer? And they were more than happy to take me on. But I felt, right, I need to take this opportunity. Yeah. So I did a couple of courses with composite work, the mini smile makeover one with Tapesh. It was great. Loved doing that. Few composite courses. Really enjoyed them. And then thought I wanted to do maybe slightly more orthodontics, which I've always thought about. And then went from there and did CFAS course, wanted more training, so went with the IS Academy, who were amazing because they mentor you if you want it.
So I had actually, before I left general practice to
Yeah.
go and just do implants, I was doing general, but ortho was the pinch point in my workflow.
Okay.
So I had done lots of research, and I was actually signed up to go on an IAS
Oh,
course because
amazing.
everyone was talking about the fact that the mentorship afterwards means that you learn proper ortho.
Yeah.
And I know
Yeah.
I know what Tiff's like.
Yeah, Tiff's amazing.
Yeah, and actually I only cancelled because I basically made a decision like a month later to leave general practice to do implants. But
Okay.
I totally understand, based on the research I did, why you're saying that about IAS.
And totally. And Tiff, everything, he's so ethical
Yeah.
and minimal. Everything he says, I just believe. I did the online courses over COVID, then I've done quite a few in person, and I've worked my way up. There's like a kind of a learning tree where you start with your basic cases, and they're really good because they won't let you run before you can walk.
Yes.
You have very simple cases with just anterior alignment, tipping and tilting, and they mentor you every step of the way. I was lucky to have, I'm quite controlling. I need to know everything. I don't like to go, and I can't wing something. I need to be prepared and know everything. And with ortho, you can't obviously know everything. It's not an exact science. But the mentors gave me the confidence. I had an amazing mentor, Claudia, who I'm still really friendly with. She doesn't work as much now. She would give me every step of the way, simple step-by-step instructions. So I had the confidence to go in, which I didn't get from anyone else or any other company, because I just felt like I wasn't prepared enough unless I had that. And she made me so confident on my first cases. And then it grew from there. She explained everything. She'd annotate pictures for me when I sent in the photos, the clinical photos. She said it's exact IPR here, here, and here, and explain why. So I understood everything, and these are the consequences and the planning. And the planning is so important. And they make you plan like an orthodontist, and the case will not be approved unless you've done that and have all your records. They really look after you, and they seem to care, which is so important.
Yeah.
And I just love it, which is why I went on to I did the simple aligners, and then you don't know how much you don't know until you do more courses.
Yep.
And I wasn't happy just to be providing the basics. I thought, right, I need to do this properly. So I've been doing fixed aligners, and now I'm fixed braces as well as aligners, and now I'm doing the diploma course, which is intense, but I just love
Through
it.
IAS
Yeah,
as
through
well.
IAS. So everything
how
has
far
been.
can they take you?
This is as far as it goes. So the IAS diploma. So Ross Hobson, who is an orthodontist specialist, it's his course, and you get your PG diploma at the end of the day. So you're just below specialist level. So I can do pretty much all an orthodontist can do. So we taught lingual braces with Asif, who's amazing. Josh Rowley's teaching us aligners. So aligners are part of it as well. So yes, I won't be a specialist, but I'll be pretty much there. It's the best way to get there, because you don't have to be a specialist to do orthodontics.
Yes.
But I wanted to just know as much as I could and learn, so I can serve the patients as best as I can. I really love it, and I just want to do the best job.
Brilliant.
And
Brilliant.
yeah.
Do you think that cutting down your clinical commitment from pre-COVID has allowed you to do better and more complex work?
massively,
Yeah.
massively, because I have the time. I have my Tuesday and my Friday where I have time to plan cases, to write them up. Obviously I started slowly, and now I've got a lot more cases on. It's worked quite well because I was lucky, I guess, that I could work part-time and take the gamble of, is this going to work? Is this not? Bob and Dave have been so supportive, saying that I could go on the courses. I hadn't been there very long, and Dave phoned me and said that he'd seen I'd done a few courses, and would I like to be part of their cosmetic team. So there were 4 dentists, 2 girls, 2 boys, and they asked me if I wanted to be, and I was a little bit overwhelmed. I said, I'm not sure if I'm ready yet, and I don't want to like run before I can walk. And Dave was like, no, that's fine. We're happy with that. You take your time. We'll support you, which they have done. And we've gone from there. And I've just worked my way up. And the team, we've got amongst our 5 practices, there's 40 mixture of dentists and therapists that are now all referring into me.
So is that what that means, to be part of the cosmetic team, that then you're kind of on the list of people that everyone else refers to
Within our group? Yeah.
Brilliant.
So, and then if people phone up and want although I'm a cosmetic dentist, I do a lot of functional. So with my orthodontics, it's it's not aesthetic, it's aesthetic and functional. So I try to look at the bigger picture.
Brilliant.
And that's where I fit in. That's kind of my niche area. I was quite lucky. We had lots of very excellent clinicians doing aligners and a couple of people doing some simple fixed. But we didn't, there just seemed to be a little bit of a gap, and I seemed to slot in, which was just amazing because that's what I wanted to do.
So you're handling all the complex orthodontics, essentially.
Complex.
As complex as you would take in primary care, basically, is what you're handling for the group. That's awesome.
Yeah, totally. And we're really lucky as well. We've had an orthodontist who started with us who's working every other Friday afternoon just for one session, and I'm working with him, which is brilliant. He's because obviously I haven't taken the traditional masters in orthodontics route. We've had different pathways. He's been nothing but supportive. He knows I'm coming here today. Speaking to him earlier, I'm meeting up with him on Tuesday because we've got a plan of where we're going with orthodontics, and he's working with me. So I'm incredibly lucky that I have an on-site mentor if I need as well. All my patients know I have mentors. I'm very open about it. They seem to love the fact that I love it and that I'm getting everything checked just because I want obviously I'm confident in what I do, but I think everyone can learn and have a different spin on things, even if the mentors are just agreeing and saying, yeah, that's great, crack on with what you're doing. It's just having that reassurance from mainly orthodontists. So
No, that sounds absolutely amazing.
I'd recommend it to anyone. I have recommended it to everyone. It's so good. I don't know how you could do orthodontics without doing it, really. You need to know everything, and the IS prepares you, and they care. They want you to be the best clinician you can be, which is important to me. You know, you've got to understand it or know the theory.
They must be doing such a good job to have their students coming out as ambassadors.
Yeah.
Are you doing some work with them now as well?
So, what do you mean work?
Are you working to help train the next?
No, but that's where I'm kind of aiming to go.
Cool.
So I've been approached by SureSmile to be a key opinion leader, which is in the process at the moment. Said I was a bit overwhelmed to be asked because we've got the likes of Tiff, and I'm like, I'm not quite sure where I fit in because these guys are so experienced and I'm relatively new, been doing aligners for 4 or 5 years, where they've been doing it forever and lecturing, but they seem to like my passion and the way I've come in and the way I've grown with the IS Academy. I spoke to Tiff recently and said I'd love to come on board with, he knows that I'm obviously KOL now for SureSmile, or starting, it's all in the process, these things build, and they're happy to build with me as I get, more experience and as my advanced diploma comes along. And Tiff has said once I'm finished my diploma, then hopefully I can come on board and help on his ABB course, Align Bleach Bond, give something back. I'd love to mentor and give back what everyone's given to me. So important. And like, being part-time, it fits in with that as well. You can do a bit of both. So that's the plan long term. Incredible.
I mean, I have to say, like, Flo and I were chatting about who we invite onto the podcast, and your name came up really quickly because we've seen how we've never met.
No.
All of us have never met.
I was really shocked you asked me. I was very overwhelmed. I was like, I'm not quite sure why they're asking me. Great, I'd love to be, but I didn't quite know why.
You can tell your passion, but also the things you share. We know you through social media, and the things you share are positive, and you're demonstrating like a work-life balance. It's all the fitness stuff you put up as well.
I love doing that.
Yeah, and then you've got family. And your work is immaculate.
Oh, thank you.
And you shout about it with humility, because we have to. It's absolutely a good thing to show your work. It's a way for you to audit. It's important for work like that to go out there so people can aspire to it as well. It's so many good things. And
thank
and
you.
the thing is, you're doing it with a family, which is it's incredible. I know so many amazing dentists who, for want of a better way of saying it, have been derailed by having a family and then wanting to go back to it and not really have the confidence. And I think it's so difficult for women especially. Zara's going through this now we have a 2-year-old, and kind of when do you come back and what can you come back to?
Yeah, it's hard when I was 2, so I've had a couple of opportunities to buy practice. I could have bought my dad's practice as well. And again, it was either my husband was going to buy the pharmacy or I was going to buy a dental practice. It was one or the other.
Not both?
No, I didn't. When he had his, I thought he's very busy. I don't know if it's different as a mum. I be careful what I say, but I wanted as a mum to spend a lot of time with my children. That's what I've always wanted them.
Yeah.
And I'm lucky, I guess, in dentistry as a career that I can. And when I knew my husband and his business, and because he's got his business and busy, and obviously he's great with the kids and does a lot with them. But I just thought two of us having businesses would be a bit crazy. So
Any regrets there?
no, not at all.
Brilliant.
Not at all. When COVID happened, I was jolly pleased I didn't have a business.
Yeah.
I think it's amazing what everyone's been through, and it's a lot and a lot of stress. I love my job, but I like the fact I can go home and be a mum and I can do my bit, but I don't have any of the stresses of the business side, which you were saying on your podcast. We're not taught the business side. We're not at all. I don't know if I've been be good at it or not.
But it's not an itch you feel like you need to
No,
have scratched.
not at all. Orthodontics was.
Okay, brilliant. Okay, so what's the tip for someone who they're in a practice where they're doing general work, but there isn't the demographic to carry out ortho, but their dream is to do ortho, and they're looking at courses. What's the order? What should they be thinking about?
So my demographic was, I don't know the exact stats, but it was more elderly generation. Obviously it's still useful, but a lot of what we were taught with IS, the TIF, was treating ortho for functional reasons, so that you don't need the complete rehabilitation in the future, because we're protecting the bite, not having constricting envelopes of function. Most patients, every patient that I see, I have, because I'm private luxury, I have a longer appointment time, so I can explain. TIF shows your teeth shouldn't be meeting like this and hitting against each other. You should have a nice free envelope of function. Most people have a constricted envelope of function.
UK orthodontics.
So potentially everyone needs this treatment. It should be a part of every GDP's examination. Having the confidence and the knowledge to do that, you need to TIF's course to do that and to know, because every patient can benefit from it. So although I'm saying it's a demographic, unless it's a very elderly, or obviously you're treating kids, which is different because there's different orthodontic reasons, most people can do it.
So you're part of a team of like 40 clinicians in the group. How do you give the clinicians who haven't been on IAS, how do you give them the eyes to be able to, what do you do to convey this to the rest of the clinical team so that they know what to look for?
So we've got a group of, we've got 3 young lads that have started with us who are all brilliant. They've been shadowing us quite a lot. One of them, Lewis, in particular, has shadowed me quite a lot, so he knows exactly what I'm looking for.
Brilliant.
So he sends referrals to me.
Is that how the group brings in new people? Is that built into kind of their mentorship and them coming into their new job?
I think that's the way forward, and I think that's the way we are looking. Yeah.
That's
so
awesome.
Nurturing the young dentists who are all excellent clinicians. I know they're all going to do brilliantly. Yeah, and we have quite a lot of team meetings, and we have associate meetings online, and we discuss things, and we have WhatsApp groups. And so now I've done my diploma, so I can, or now I'm doing my diploma, so I can treat children for simple orthodontics with extractions. The group now know that to refer into me as well as to Will, so we're all quite open and lucky to work with a nice team of clinicians.
That's really cool. Sorry, Flo. I have so many questions. So that's really cool I think that's such a benefit of being part of a group. I think some of, this isn't a corporate. This is 2 guys group who they look after everyone really well. It seems
it's
like,
not a corporate. It's like a big family.
Yeah.
It sounds cheesy, doesn't
No,
it? But it is.
I get it. I mean, Joe Broad is a friend of mine, and he was in my year. His work is incredible.
Yeah, Joe's a talent.
I know Joe would.
He said to say hi. I said I was coming down. Because Joe and I share a surgery.
Oh, cool. So
I see Joe a lot. He was extremely welcoming when I started, because Joe is so good.
He's a lovely person. His work is immaculate.
Yeah.
But the thing is, people like you and Joe wouldn't stick around if it wasn't like a family. But it's interesting because this group has 40 clinicians, and they're using the whole structure the right way to mentor the people coming through, but to get people like you who are advanced in their education and pushing the boundaries to get you the patients and funnel that through. And I guess this is not a question, but it's a comment to say, imagine the big corporates had the foresight to structure things like this. I mean, it just shows that actually people saying, oh, you should just stay at a very small, like 3 surgery independent. That's not the case, because if you want to be doing orthodontics full time, it's much easier to have a group sending you the cases than to be hunting for referrals across the city.
Yeah, exactly. So they all come from in-house. So there are regular patients. We've got quite a big social media presence, so we get a few from them. A lot of my cases have been referrals from patients to patients to patients, which is coming. It takes a while to grow, but it does snowball a little bit. If you do a nice case, someone's got a nice smile, where do you have teeth? And then they're coming to me that way, which is quite nice.
That's incredible.
I think that that word of mouth is definitely one of the best advertisements out there that you can get. And I like that whole element of the observation as well. I definitely found, like, doing my mentee here, just that was so useful, being in the room and being able to sort of see how different clinicians work, the phrasing different people use to describe things.
Exactly like you said, the phrasing. I've coined a few of Joe Broad's phrases from when I started. I've shadowed him a couple of times, and when the youngsters are coming in, I'm picking up phrases from them and seeing how they've been taught, because they're fresh out of uni. They're like encyclopedias. I can get so much knowledge from them. I'm like, great.
It's brilliant. Yeah.
Do you have a favourite phrase that you've sort of picked up?
No, I don't. I do this all the time, every single patient, so Tiff would know that. I do
It's
that.
Aston goes rat and cow a lot with his hands like that.
Yes.
No, that's awesome. And if you looking back now, like, you clearly, there's no regrets, you know, apart from mum guilt. Your journey has brought you to a point where you're enjoying your clinical work, you're doing really well. Is there a piece of advice, if you could go back, that you'd give yourself that would have made your journey easier, faster, and made any difference to it?
No, not really. Just sit tight and it will all be okay. Because you've got to, as I was saying to you earlier, I think it's quite important as a young clinician to work hard and do a little bit of everything. You've kind of got to earn your stripes, I think, and it's good to do good general dental work and NHS work, so you can practice and work out what you're doing and what your field that you think you might be good at. It's good to do everything. Sorry, that was a bit flaky answer.
No, it's fair.
Not at all.
You're just so happy that there's nothing that you would change about your journey. It's lovely.
I don't think so, because you can't change your past, and it's what shaped you. I'd never go back and change anything. I think I'm quite a positive person. I look forward, and everything you learn from everything happens for a reason. I'm a firm believer in that. So, and you learn from your experiences. And if you think, oh yeah, I will learn from that, I always try and put a positive spin on it. I said my dad and my mum I'm one of 3 girls, we were always taught that we can do anything, which I think is quite important for a girl.
So actually, you've done everything. You've had a family, and you've built a career. So I guess advice for 2 people. One is the mum who just can't find or the person who wants to be a mum who can't find a good time to have kids. And the other for someone, a female involved in dentistry who doesn't have the confidence to get involved in committees and publishing and saying, I want to help teach something that I'm really good at. How do you get into what can be quite an intimidating world?
The second one is have a good boss who will support you and champion you. I can message Bob and Dave pretty much whenever I like, and I know they've got my back.
Brilliant.
I think that's really important. You know, I trust that they'll look after me. Get a mentor. Makes a huge difference. They give you the confidence, and then everything goes from there. Not everyone's going to publish or want to use social media. You don't always need to. So we get referrals in house. You don't need to do that. I do it a lot because it's self-reflection, learning. I love taking photos of my work. Whenever I have if you were a new patient that came in, I'd have someone with teeth like you didn't need ortho, but if you did, I'd have someone that had similar photos. I'm very visual. I like to explain things like that, so I love taking photos and showing that. I like putting my sport on social media because I think it shows that I'm a real person, and hopefully people will find that it's easier to chat to me. I try and build up a relationship with my patients because if they're an ortho, it's a long journey. They have to trust me and hopefully like me. So I try to be as friendly and as nice as I can. I think being nice goes a long way. So I try to
How do you find a mentor if you want to find a mentor? Because it's great advice, but
so with me with IS, it's through the academy.
so that's a
So
great
they
way to
provide
start.
mentors. They've got loads of mentors, and then you have different mentors throughout. Now I'm on the diploma. I have my own specialist orthodontist. I have one mentor for the PG diploma, so that you get, because obviously you can have slightly different ideas. So they're keeping us with just one mentor.
Brilliant.
But I've got other cases with anterior only alignment still going on where I have a range of mentors. It's quite nice having a range because you pick up slightly different things because people explain things differently. I ask a lot of questions. That's something I'd say to someone: ask as many questions as you can, because that's how you learn. No question's a stupid question. The only question that's a stupid question is the one you don't ask.
It's very true. I definitely though sometimes get scared to ask those questions because of that judgment.
I don't so much. That will come with age though, because I'm a lot older than you. You get to my age and you think, I'm just going to ask because I don't mind if I look stupid, because they were very good at saying this on the course actually. They said, if you want to ask a question, do, because chances are 9 people in this room are going to be thinking the same thing. So I don't mind, because I think if I'm on a course, I want to get out of it as much as I can. And what's the point in me doing this diploma if there's something I'm thinking, oh, I'm not sure, so I'll just ask.
That's brilliant.
I just ask.
That's actually such a good piece of advice, that choose courses that will give you the support and mentorship.
Oh, definitely.
That's the way you start. All these relationships that have led you to this road have started like that, haven't they?
Totally, because it wasn't just a weekend course and that's it. It was the start, and then you're mentored the whole, and the amount that I've learned from the mentors, like from every single, I mean, it's going to be hours of CPD and peer review, because all the photos, and every time the patient comes in, you have your photos and your case notes, and you discuss it with the mentors, and you learn so much stuff. It's fascinating. It's a puzzle.
Do you think someone who was working more days a week and could fit that in?
Could do. I suppose it depends if you have a family. If you have a family, and depends on what role your partner has as well. If you're and just what your values are. And everyone's different, and there's no judgment, because I wanted to be part-time, but lots of people don't have the luxury of doing that. Everyone is totally different. It's whatever you're happy with. We all have to sleep at night. So
I really like that. That's a good way of putting it. Yeah. We all have to sleep at night, so it's whatever you're comfortable with is what works.
Yeah, definitely.
Can I take you back to any advice for women in dentistry who can't find the right time to have kids?
That's a difficult one. That's kind of why I avoided that question. The second one was easy. It's really difficult. I can't think of an exact answer for that one. Sorry. As you said, there isn't a right time, and I'd hate to say just go for it and then it not be the right time for someone, and that be my advice. So I'm not going to say that. You can't answer that question, I don't think, unfortunately, or I can't answer that question, because every situation is totally different. You've got to be in the right position in your life. Actually, maybe you'll know when the time is right. Maybe.
I hope so. I think there's a good shout for the fact that mentorship is not just clinical advice, and actually, your mentors can help you think a lot of processes through.
Yeah.
And I think there's a lot of people who have made mentorship, if someone only knows you clinically, it's not actually mentorship. You need to know each other and trust each other. It's a proper relationship.
Totally.
And actually,
trust is a huge thing.
These are great things to be able to discuss with a mentor as well, because
totally.
The difficulty with speaking to your boss about it is it's great that you have kind of practice principals or directors that are like that. We try to be that here, but the big thing is your mentor doesn't have a vested interest in any other part of your life, just your development and happiness. And I think it's really cool that you've got so much mentorship where if you're touching base weekly or periodically, probably having so many conversations about so many things with people who have been there and done it that
Totally, you're right. Particularly Claudia. Claudia was one that introduced me into SureSmile aligners because she was a trainer for them, and she said, "I think you'd be good at using those as another system. Why don't you try it?" It was her that introduced me to them, and then said about doing the fixed cases. When I originally did the fixed course, I quite quickly did the second one because I was known to the IS Academy, so the mentors knew because of my caseload and the work that I was doing and producing that I was ready for it. Then they were the ones that encouraged me to go on to the diploma, said how useful it would be. So yeah, I've got a huge amount to thank them for because it's literally changed my career around. I'm doing the dentistry that I love. I've always loved the job, but this is where my passion lies. I just think
did you get into a rut with what you were doing before?
No, I loved it, but it was
Brilliant.
very safe. I've
Yeah.
just been doing the same thing. It was possibly ideal with a young family. Yeah, it was great. I loved it. If Doug hadn't retired, well, obviously he did retire, but if he'd been, 20 years younger, I don't know, maybe I'd have just stayed there and it would have been it was great. I loved it, Ed. It was good dentistry, happy patients. It's just different.
Do you think it's quite good as well that you've had those mentors as male and female? That you've got sort of those different opinions as well?
Yes. Yeah, I like things explained a lot, and so possibly, no, I'm not going to say that.
No, it's fair. What you were going to say is fair.
I was going to say, no, I'm not going to say that. Maybe you
You're
can
right.
say it.
We're all thinking.
Yeah, we all know what you're going to say.
We're all thinking the same thing.
Yeah.
Possibly some people explain things a little bit better and know how the female mind works and how I need every detail explained. That's how I work anyway. And some of the mentors have been fantastic for that, really spoon feeding. So you go in, yeah, I'm confident. I know every eventuality. There's no grey area. And that's what I needed to start.
Have you found at all the dynamic with patients and you being a female dentist has ever sort of had a negative connotation?
Yes. When I worked, particularly when I was younger, I had a couple of people who have been in where I worked in my other practice. It was traditionally men clinician for a long time. I was the first female dentist that had worked within that group. There were a few male patients that didn't want to see me, had never met me, just because only a couple, but just because they were used to seeing a male dentist, which is interesting. So obviously I didn't see those, but that I have with patients with dentists. When I was a younger dentist, I went on a private dentist course that was very male orientated, and I went with one of the principals from a different practice I worked in, and everyone assumed I was his nurse. Everyone. Oh, are you his nurse? No, I'm his associate. Okay, which is fine, but it's just interesting. So I have had that. I know you said, sorry, the question with patients, but I have had that in the work as well. Not as much now, actually, at all. Maybe being a little bit older as well. Don't get that.
It's kind of one of the things that it's often innocent, but it's still a bit jarring, and it's why it's a weird thing. We talked about this on the last episode, but why we have clinician scrubs and nurses scrubs.
Yeah.
Because
I mean, I still get, oh, you're the dentist.
it's because you're so young, Flo.
Yeah, I used to get it all the
Take
time.
that.
You do, but you do though, and it's hard. Then it is hard.
I
You
think
don't get that as a male dentist at all.
no, and I think even they did it at Cardiff Uni. They did one of those unconscious bias tests where they flashed up different professions, and you had to think about who you picture. And it's even though there's a higher percentage of female dentists now than male dentists, people will still picture a man as the
interesting.
dentist than a woman.
We need a prominent role in a movie that's
Yeah.
a female dentist to
Well,
erase Steve Martin and all the other big dentist roles.
There was Jennifer Aniston in Horrible
That's
Bosses.
true. That's actually true. Yeah, that's true.
Probably not the best
Yeah,
role
maybe we
model
could-
to go with there.
But there
Maybe
are
find someone else.
on a lot of the courses I've been on. It's a lot of male lecturers
Yeah.
still. which is interesting.
That's what I always say to you.
I mean,
And a lot of male mentors as well.
why do you think that is?
Maybe family. Is it? I was speaking to one of the dentists at work before I came here about male, just from a male perspective, because it's interesting. Speaking to a couple of the nurses, saying, "Do you find it different working with male dentists?" Just for someone else's opinion as well. Putting the girls on the spot, bless them. I think it's more personalities than within our practice, rather than with male and female specific. No one seemed to mind whether they worked with a male or a female dentist, which was good. What was the original question? So I've lost my train of thought now.
I don't know. I
saying
feel like
something, I've
that
lost
was
my train of
interesting. I don't know. We were talking about kind of if gender plays a role in kind of teaching and going higher. I mean, personally, I don't know. I think it's a confidence thing. I think, in my experience, males are much more likely to either think they have enough experience so they can do it, or to know they don't, but they may as well fake it till they make it.
Oh, I know, and I
Whereas
can't fake it till I
females-
make it. I need to know what I'm doing.
And
I don't like that phrase. That's funny.
Yeah.
I would never use that.
well, it's the opposite of everything you've been saying
Yeah,
so far.
exactly.
But it's interesting because
Couldn't do it. I couldn't do it.
maybe a lot of what we're putting down to, or you've had to take time away from work to raise a family, is actually just women, once they make it, it's because they've really earned it.
Yeah,
And
driven.
males are just quite happy to be like, oh yeah, I'll do that. Yeah, I know what I'm doing.
Yeah, because as a woman, you obviously we physically have to give birth. So you have to have the time off to recover, and you've given birth to that baby and brought them into the world. So it obviously different roles between males and females. So you have to juggle a lot, and I'm lucky that I work part time because there's a lot of juggle. And my boys as teenagers need me as much now as they did. Lots of people have said, oh, when the boys were in high school, would you work more? Absolutely not. They're rugby and football and drama and saxophone, and they do everything, which is great. That's what I want them to. I want them to give every opportunity and for them to fly. But I also want them to see their mum working hard, and that you can do that as well.
But what is
Try to juggle everything.
what is full time? Because I think we're talking about full time as when you're seeing patients, but you've alluded to how much you're doing outside. You're publishing, you're teaching, you're learning, you're working with industry.
Yeah.
And actually, these are all natural parts of a clinical dentist role as they progress, and if they're passionate and they're doing well. So what do you think is full-time in dentistry?
That's a good question, isn't it? Yeah, because you could argue that I'm doing full-time behind the scenes because
I would argue you're doing more than full-time if you take everything into it, and actually that you're still managing to be there as mum.
Yeah.
And I think I'm only saying that because I want us to normalize that, because we don't always see or considering. We think of work as when we're seeing a patient.
Yeah.
But the
and
amount of work it takes to plan
behind the
cases
scenes,
and
yeah.
keep going. I'd argue that for a lot of dentists who are involved in other things, Flo, you're publishing, you're learning, you're involved in projects. I'd say 3 days is full time. It's just that for 2 days, you're not getting paid.
Yeah.
Do you see what I mean?
Yes, exactly. That's a good point. That is a good point, because there's a lot that goes on behind the scenes, particularly when I started with the orthodontics, because so much you have to learn. So the cases would take 3 times as long to plan. So check everything
and not that this is a driver, but one of the things we also have to remember, everyone who's maybe not really put that together or lacking confidence needs to understand that the 3 days you're seeing patients needs to pay for you to be able to spend those 7 days recovering, learning, progressing. There's a lot of aspects to
Oh,
it.
totally. Totally. Yeah.
Did you mean 4 days?
No, I mean 7. No, 7 includes family time. It means recovery. Is that sorry?
Okay.
Do you mean full time?
You said, oh no, I'm just confused with the maths.
Sorry, 3 days
10
is.
day week?
Mine is no. 3 days is full
That would be
time.
helpful if there were a few extra
Yeah.
days. It'd be sorted then. Get
That's all,
everything done.
That's all we need. But 3 days, because I think there's a day of admin to do 3 days of complex cases. You need a day of admin. And then you need a day to teach, learn, and be involved in other projects in dentistry. And then there's a 2-day weekend, which is essential for your recovery and for family time.
Yeah.
I don't think if you're doing complex clinical dentistry where you're constantly progressing, I don't think you have more than 3 days worth of clinical time in a week, personally.
Well, that's what I do, so that works for me.
Yeah, just going to agree you're full time.
yeah, I'm full time.
Yeah.
Yeah.
Brilliant.
You use social media sort of really well.
Yeah,
Do
I'm
you
trying
find
to.
it a positive or more of a negative having it there?
Massive positive. I know lots of people don't, but I've seen nothing but maybe that will change over the years because I haven't got a huge following. That will hopefully grow, but that will come as more patients see me. I use a lot of it not necessarily to attract patients, but to show existing patients what I do, because there's quite a lot of videos. People can see the courses that I'm going on, how much I care, how much I'm putting into my work. They can see cases of something similar. So if you came into me, I'd show you my Instagram and say, here are some cases that I've done. There are videos on there for IPR, which is the slenderizing of teeth. I've got videos of that, so I can
I like that.
reassure
Say,
people.
"Oh,
Slenderize.
Yeah,
Nice.
it's a good
Okay,
word.
cool.
It's a
Cool.
good word.
Yeah.
We are
I'm taking that
slenderizing them
phrase.
so they fit together
I think there's
nicely, so
about,
they all
like,
line up.
I don't know how many
Special
followers
K
we have.
advert for-
I don't know how many people subscribe to this podcast. There's like 10 people out there who are now using Slenderize
Yes,
from now
it's
on.
great. It's a good term.
That's awesome.
Yeah, it is good because you're right. It's slenderizing, so they all line up together so nicely.
I
I talk with my hands a lot,
No,
and
It's good. This is on YouTube then. Yeah,
fabulous, fabulous.
no, I really like that you've also explained why you're using social media, because it's such an important thing for people to understand that there's different ways to use it and things to use it for, and that it might evolve, like you alluded to, it might evolve into something else. But actually, you've gone, you know what? It's a modern world. I'm actually going to put my cases on there, and I'm going to direct my patients to there rather than just
Yeah.
having flyers or whatever it is. It's a cool way to showcase and direct.
Yeah, I
and
try
more
to do it.
sustainable. Less
Yeah,
contacts.
exactly. I think it's the way forward, and everyone's
Yeah.
got a phone, and people look at it and seem to like it as well. It's a nice way for my orthodontic patients can contact me on my Instagram feed as well if I've had a few people that have been abroad and they've lost an aligner. Someone was in Bali and their aligner got recycled, and they messaged me and I could order another one. Obviously, they can phone the practice, but with my orthodontic
That
patients,
is so helpful.
I
I
isn't it?
provide that because they're all lovely patients and they're paying a lot of money, and it's just that reassurance. It takes me 2 minutes to reply.
Yep.
If it's something more complex, I'd say, can you bring the practice in, book something in, and we'll have a chat. That's no problem, but I provide that service. I think it's really important that they know that I'm there for them, because I'm always on my phone. So if someone messages me and they say, oh, I'm really sorry, it's a Saturday. People don't message very often, but if they need to, that's there.
So very little of the demographic I treat are on Instagram.
Okay.
But I got a message last week from a patient saying, oh, my implant crown's come loose. And I was like, great, I'm so glad out of hours you were able to message me rather than get into a panic.
Yeah, that's
and I
the
love
exact
that,
reason.
yeah.
So I can reassure them, the brackets come loose. Oh, brackets come loose, what do I do? We can put a bit of wax over it, it's fine, don't panic, then they're fine.
Yes.
So I had someone message me, they just about to start a liner treatment, and a bit of a filling had broken off, what to do. I was like, don't panic, I can rescan, it's fine, don't worry.
Brilliant.
It's reassurance,
Yes.
that's the thing, and I don't mind doing that.
It's peace of mind for both of
But
you.
exactly, it takes 2 minutes. It
Yeah.
really does, and everyone's on their phone, aren't they? We've all got our phones here. We've been today, so it doesn't. It's. I don't mind doing it.
Yeah, brilliant.
I have loved this chat. Come to the dental quickfire quiz that we ask all our guests to enter you to earn your dental pearl.
Oh, exciting!
So what?
Flo, I've listened back to the last episodes. This is such a weird phrase. So unless we're actually giving someone something, I'm finding it too weird.
It's a metaphorical pearl. We're called pearls.
Can everyone write in and if I'm the
I'll
only one
have a
finding that
little
weird,
pearl.
I'll just shut up. But if anyone's finding this weird, okay, carry on.
Which is your favourite procedure to do?
Oh, orthodontics. That's easy.
That-
No brainer.
What is your favourite scrub colour to wear?
Pink.
Love that. Love that.
That's easy as well.
With no context, which is your favourite tooth?
Oh, can I have two? Either a central or a lateral incisor.
Okay, I like
Either.
that.
Yeah.
Laterals are tricky. I like laterals for that.
A left or a right?
Challenge. Left.
Left.
Yeah, you were pointing already, yeah.
Yeah. And if you were just leaving school now, what would you want to do with the knowledge you sort of have now?
Oh, exactly what I'm doing now. I wouldn't do anything different. Love it.
Amazing.
Can I just say, Rebecca, I love your energy.
Oh,
and
thank you.
And I was excited to meet you, and you're even cooler than I thought you would be off social media.
Oh, I don't
And
think I'm
it's-
cool.
No, you really are. Like you're passionate, you're positive, and I'm really pleased that someone like you is in our area and part of like our dental community.
thank you
So
for
such a
saying
pleasure
that.
to meet you. Thank
Oh,
you.
well, it's an absolute pleasure to meet you, and I'm honoured to have been invited on. As I said, it was a bit of a shock, but I'm delighted. It's been loads of fun. Really lovely afternoon. So thank you
Oh,
for
no.
having me.
Well,
Thank
thank you for coming. Ali, why did you invest in the Navident dynamic navigation system?
It's incredible. It brings our safety and accuracy up for patients. Here's a tracker that we use, and thanks to Rob from the dental imaging company, it's been great support and so easy to set up. I see why so many people go to him for their digital imaging, 3D or 2-dimensional, and also all their surgical supplies like Ustamed screws. Rob's been incredible, and I'd highly recommend working with him.
Ali, can you name everything in the practice that's made by W&H?
Ooh, off the top of my head, all of our handpieces, our sterilization equipment, my implant motor, the PiezoMed, they're an incredible company to work with because they're an Austrian company that focus on hygiene, and we know from studies that patients care most about hygiene. To top it all off, the support we get from them is amazing. They don't actually supply the equipment, but they provide the support. Now that's true support. Crown Dental Burrs have a rota system, and what that means is I have the same burr box every time with the same burrs numbered. I ask my nurse for the number of burr rather than having to remember the name of it. And it also means that when I need a new burr, we go to the box which has this card, and if we are running out, my nurse can just scan the QR code and order the same one. So we never have problems with inconsistencies with burr boxes or burrs. Thank you very much for implementing this for me, Paul. I love it. And the other thing I love is that Paul's a problem solver. So I worked with him to curate this alveoplasty set, which he has such great knowledge for all of his burrs. And it means that we have everything we need for full arch surgery. So whether you have a problem with your set and need this set, or you have a problem that you need help solving, Crown Dental Burrs will help you do it.